are meant to be carefree, run free outside at whim. But what happens when conditions associated with adults like arthritis take on our young ones? In today's show, we look into juvenile idiopathic arthritis, or JIA. My colleague, Dr. Nosipo, went to check in on one smart young girl living in Guatemala. Dr. Nosipo tells us more.
Dr. Silo, today we're in Guatemala to meet an 8-year-old girl that I've heard is very smart, Lucanio, who's been living with juvenile idiopathic arthritis. Today, we're going to do a health check-in with Lucanio and her mom to see how they've been managing this condition.
Yeah, sometimes Mila abuye ekhaya bangifonela esikoleni ukuthi hayi ayikho right ngizomlanda. Sometimes we are over right attend ilanga lonke. Bayeza bazokuthi kukhanya because ukhanya bomntana obhabli odlala estradini wonke umuntu uyamazi, but manje sekasikars bazibuza ukuthi like ngaba shocked ukuthi abantu ba consent baza abazali hawu ukhanyo asamboni abantwana bashela ukuthi uyagula ngithi hayi uphethe into sosayi ngawari sizomkhulekela. My name is Nonhlanhla Nkosi. I'm 33 years old and staying in Guatemala Springs. And this is my daughter, Lucanio Nkosi. She's 8 years old.
So ningashela ukuthi amalanga wenu anjani no Lucanio every day. How do you prepare her for the day?
Okay, savuka ekuseni, obviously umzimba ubuhlungu. And then I prepare a breakfast for her. Maqeda ukudla breakfast imela aphuza medication yakhe. Khona kumele ngiyibhake esikoleni azoyiphuza lunch time.
And when you were pregnant, Masijele, were you expecting anything that was wrong? Did you suspect anything? Noma yonke into ihambe kahle with your pregnancy?
She was born perfect. Everything went well as yonke into ihambe kahle. I wasn't scared, everything was fine.
The checkups also were good. They were
Yes, they didn't find anything wrong with the child.
And then waqala ukumbona nini ukuthi uyagula?
When she was 2 years old, yeah, she started to be sick. Waqala wagula. Ama-joints, inyawo zajika, ama-joints waba round, ngathi uyadumba. Izandleni, azange asakhona nokuhamba. Aloku ahlala ahleli. Bangi-advise ukuthi ngithole ngevaselina, nge-Adamants. Ngenza kanjalo. Hayi sihamba abo-doctor. Amakliniki bangapick up next. Bathatha ama-X-ray. Next bathu right. Siloku bekuyiyo le mpilo up until she decide ukuthi sobona i-pediatrician. Uyeke wapick up ukuthi ukhanya ne-arthritis. Bekahlala khala because akusumntana othanda ukukhala. Bekahlala khala and uma umguga uprefera ukuhlala kunokuthi umguga because uma umguga ukhala kakhulu kuba ngathi uyamlimaza. So bekahlala epremeni ngibeka lapha eprema ahlale bese mangimguga ngithi ngiyomgeza uyakhala ngingazi ukuthi why mangimbamba uyakhala but mangahleli kuba ngconyana yabo. Yeah, ngizibuza ukuthi kusami naye akasho because akakakhuluma ukuthi kubuhlungu kuphi. But mase ngibona ukuthi hayi kusho ukuthi kubuhlungu la ngoba uyadumba ngezandla. Noma eclinic bakhombisa ukuthi aba-pick up ukuthi yenzakalani nabo. Leyo part vele beyibuhlungu ngazi ukuthi umntana uphethwe yini. Ibuhlungu leyo part.
Bekana ngaki ngaleso sikhathi?
Bekayenza 3 years.
So kuthathe 1 whole year ukuthi nithole
ukuthi beku-up and down doctor clinic. Abadokotela bangaboni like sibambile abadokotela baningi bangapick up next.
Makabamba yena u3 i-medication abamqale kuyo, is it the same medication she's taking now?
Yeah, enye uyekile because enye sometimes beyimdumbisa kakhulu sokuthi uyadumba. Udokotela wathi asizame enye because i-metrosate ne-folic acid uqale nayo usayiphuza namanje. Yeah, enye siyishila along the way enye kanjalo kuya ngokuthi ibody yakhe prefer medication.
You can just tell us how it's like to be in hospital with other children that are sick.
It's not good.
How does it make you feel?
Bad.
Akubi mnandi khona ubona umntana gula. Sometimes masingena esibhedlela bamnika i-drip bese siyabuya lokutshisa kuyehle bese immediately sifika la endlini ucalela phansi futhi sasakhona kumele sibuyele esibhedlela loku-travela kuya esibhedlela in and out akukho right. So ukuthi kuthatha isikhathi ukuthi baze bama-admit babone ukuthi isiza kaningi then kanti bama-admit nje. Yeah, kona ukho mnandi umbona lo kakhula.
And i-support system yakho yala ekhaya bayanisupport bayanixhasa la ekhaya?
Bayeza bazojika ukhanye because ukhanye bekumntana obhabli odlala esitradini wonke umuntu uyamazi but manje seka-scarce bazibuza ukuthi like ngaba shocked ukuthi abantu ba-consent bazi abazali hawu ukhanyo asisamboni abantwana bashela ukuthi uyagula ngithi hayi uphethe into soso hayi ungawari sizomkhulekela uzondlula kuyo like into ezinjalo nje i-support ngiyayithola kakhulu. Yeah, nabantu abangayazi ngiyabatshela ukuthi busososo like nanoma eclinic uba shocked uthola ukuthi inesi ayazi ukuthi umntana khona abantwana abane-arthritis bese-ke nacoca from there naye athola knowledge ukuthi ukaso.
And then wena Khanyo ungazikhulumela yini oyithandayo ukuyenza?
I like to read and also like to dance.
What kind of books? What's your favorite book?
My favorite book is Trouble with Dinosaurs.
But when did you start to feel sick when you were young that you can remember?
Can remember, I think, when I was 2.
2, you remember? You're a very smart girl. What do you remember feeling?
Feeling pain
Where?
on my knees and my hips.
Was it making it difficult for you to walk and to play with other children?
Yes,
And at school, was there anything that changed for you at school when you started getting sick?
playing.
You couldn't play with other children as much anymore.
Yes.
And then what do you do when you feel the pain? What do you say to mommy?
I tell her like my body so then she gives me my medication.
Do you know your medication?
I don't know lots of them.
I should tell them to kind
Only know Brufen and vitamin D and prednisone.
So do you remember when last you were in hospital? When was it?
It was last year. It was my knees and my neck and my hips. Yes, I will put injection in the hospital. Don't cry.
After the break, we continue the conversation with our experts. Now, Dr. Gail Feller is a pediatric rheumatologist specializing in testing musculoskeletal problems in children, and she's based at the Donald Gordon Medical Center and the Charlotte Maxeke Academic Hospital in Joburg. Dr. Feller, welcome to our show.
Thank you very much. I'm very happy to be with you.
All right. So today we're talking about a very, let me say, unknown, very interesting but serious medical condition called JIA, Juvenile Idiopathic Arthritis. Please just take us through, just in simple terms, what this condition is all about.
Juvenile idiopathic arthritis is arthritis in children. It's actually that simple. But the problem is that people don't think that children get arthritis. Juvenile meaning children under the age of 16. Idiopathic because the true underlying cause is not known. So we can never tell parents why their child got arthritis. But juvenile idiopathic arthritis occurs in any child And it causes pain, joint swelling, disability, and can be a very disabling thing for a young person to go through.
Hard enough to imagine, adults, suffering from arthritis. And one can imagine that it's really difficult for children. We'll come back to the, presenting symptoms and so on. But how common is this?
The problem is in South Africa, we don't know. Many children are undiagnosed. Official figures around the world estimate that as many as 1 in 250 children may have some form of arthritis. So that's quite a lot of children out there in South Africa that could actually be struggling. And probably many of them are not getting the care that they need.
So is it that perhaps we're failing to diagnose cases out there? Or is it that perhaps children, mask some of the symptoms of arthritis to make it a bit more difficult for us to detect these cases? What could be the reasons?
Well, they're children, and many of them don't have the words. They're not emotionally enough developed. If they're old enough, will complain about pain. A parent might see something going on, swelling, limping. But if they are too young to describe what's going on, it makes it much harder. And then you come back to the fact that who thinks that your child has got arthritis if you're a parent? Often these things are picked up by teachers. Many of the parents will tell us that they've come to the clinic or to the hospital because the teacher picked something up. And that it leads to a delay in diagnosis because it's much harder in a young person when nobody thinks about it. And it's not common. It's not, although you say 1 in 250, it's not as common as some of the other childhood illnesses. So it's often last on people's list.
Could it also be that, healthcare professionals out there, because of the fact that it's not a very common condition, that it's sometimes missed out there by healthcare professionals?
I think it is. And I think that's not just a problem in South Africa. It's easy to say that the child sprained their ankle, hurt their wrist, fell onto a knee. It's easy to imagine that they've broken something. It's easy to imagine it's an infection. And these are the things that usually doctors would think about first. And that's correct, because those are the commoner things. But once all of those things have been proven not to be there, it would be important for the doctors, and especially the primary doctors, to think, could this child have an uncommon disease like arthritis? And I think it's not being thought about. We're trying more and more in our medical education to reach more and more doctors and nurses, but it's still not well enough identified. Doctors and nurses are not thinking about it soon enough.
So what are the patterns that we see? I mean, you come from, both the private and the public sector. What are the sort of, patients that get affected by this condition? Is it more boys, more girls? Any particular, race that is, affected more than the other?
No, it has no racial predilection whatsoever. You can come from any background. And in terms of boys and girls, in childhood, it's equal numbers. In adults, I know it's different, but it could affect girls and boys equally. And especially in the very young children, under the age of 6, it could come from either gender. And the patterns that you see if the child is very young is that they stop doing things normally like children do, and that should alert parents, and it should alert doctors. They limp, they don't want to run, they struggle to do normal things at school, write without pain, perform their sports activities, do art. They stop using a limb, they get grumpy. And because they can't express the pain or they don't understand the pain, in some children they tell us they're not in pain. And it's because the pain comes on gradually. And when the pain is sort of coming on gradually, the child becomes accustomed. They think this is how they're supposed to be. And I think that's a pity. So it's a lot got to do with alertness, that a change in the behavior of a child along with something that could be coming from a musculoskeletal system should alert somebody to that possibility.
So how important then is early detection and diagnosis of this condition in terms of management? And I guess a related question would be, what are the long-term consequences if this condition is not managed?
Early diagnosis is essential because the earlier you get in there, the more you're able to prevent disability. Apart from simple things like relieving the child's pain and making them functional again, you prevent long-term disability and damage. The longer the arthritis is there, the more damage you're going to get. So if we can get in within the first 3 to 6 months, and that's still pushing it quite hard out to 6 months, but that's the reality. If we can get in within 3 to 6 months and start the child on treatment, the treatment works better, it's more effective, the arthritis can go into full-time remission, the child will be a normal, healthy, active child. And the side effects long-term are much, much fewer because it means you can use simpler medication. You don't have to get to the medications that have the more side effects.
Yeah. Now let's go back to Dr. Nesipo and little Lukhanya, who after 5 years of treatment still has a playful wits about her.
Lukhanya, sokucheka manje angithi? Kubuhlungu kuphi emzimbeni ngibonise? Izandla. Can you go like this? Azikho buhlungu namhlanje. Nakuphi futhi okubuhlungu khona? When a mama uyakusokondisa Lukhanya, with what else is a challenge for you to try and help to manage with the arthritis?
Like exercise. Nokukhala. She cries when exercise, but I force her. Yeah. And her medication, she even reminds me. She's good. Yeah. Kakhulu endlini sithatha ama-veggie nama-fruits ukuthi azame ukudla healthy. Senze ne-movie, i-smoothie, aphuze nje ukuthi abe right. Plus vele ama-fruits uyawathanda. I-advantage vele naso esikoleni samfakela. Yeah, ukudla healthy nyana.
So nimsiza kanjani to support her mind ukuthi mhlambe naye she understands ukuthi uphethwe yini nokuthi niyamxhasa?
Into engiyenzayo ukuthi ezinye sisibheke efonini ngimfundise ukuthi yabona kukanjani. Plus ngoba unengqondo fast ukhanya naturally uya-understanda ukuthi kuso. Yabona masingedla singayenze so udla into ekaso nawe uzincedise uzoba right. Bese-ke yinto emphushayo ukuthi adle ngoba nama-veggie angawathandi mara manje sikayawadla because ngimtshelile ukuthi yabo uma ungancedisa isifo sakho ukuthi udla ama-veggie nama-fruit uzoba.
You know, hearing from Lukhanya and her mother about how much pain she's in and about how difficult it was for them to get to a diagnosis helps me see how important it is to raise awareness about this condition in our communities.
And I think those are important points because it then applies to everybody. And all children should actually be, eating proper healthy diets and, being active. Let's come back and talk about treatment now, because I mean, this is quite a huge, important aspect of what we're going to be talking about today. How do we treat this condition, JIA?
We treat it in a number of very simple ways. Anti-inflammatories for pain and swelling, but they're not the long-term treatment because they have too many side effects to be taken forever. But in the beginning, all children will take some kind of anti-inflammatory to help the pain and swelling. Then we go on to what we call disease-modifying anti-rheumatic drugs, what we call DMARDs. And the common ones are things like methotrexate, chloroquine, cilazapyrine, leflunomide. There's a whole range that are freely available. And we try and pick one that we think will have the least side effects, it's easiest for the child to take, and they take these medications regularly.
How important is it that you start with these, so-called high-end?
If you get a child and you can diagnose arthritis, you should start with the DMARD straight away, because the sooner you start those, the sooner they're going to go into remission. Anti-inflammatories alone will not put a child into remission if they have true JIA. And that's where we come back to what we were talking about, the early diagnosis and treatment. If you can diagnose it early and you can start a disease-modifying drug early, you take less anti-inflammatories, you have a better outcome. So the earlier they can get into a clinic where we can give these medications, the better that child is going to do long term.
Children are children. They play around. They want to be free. How do you keep children motivated enough to at least adhere to medication or to even want to take their medication? Do you experience any problems with that?
We experience problems in the children when they have side effects. So some of the medications do cause nausea, tummy upsets, headaches, sometimes skin rashes. If that happens, we'll try and switch the medication to something that doesn't do that. Because I think it's very hard to persuade a child to swallow medication that it's going to make them nauseous. We treat the nausea. We try and make it easy for the children. And my experience has been if they're not getting bad side effects, or if you're managing the side effects well for them, and you've got the parents on your side, the children are very compliant with their medication because they understand it makes them feel better and it gives them back their childhood.
Your final message to parents who may be having children with this condition, and I suppose everybody else watching this program, is there hope in managing JIA? And what's your message to everybody out there?
JIA is a manageable condition. The child should not be permanently disabled from it. A child should have a normal childhood living alongside their JIA. And my message really is I hope that this empowers parents to speak for their children and not to take no for an answer if they think their child has JIA which has not been diagnosed. Ask for a second opinion. Ask for a referral to a clinic. Raise the topic. Say, could my child have arthritis? Because the only people that are going to speak for the children are the parents before they get to us. When they get to us, the support will be there.
Well, Dr. Gail Feller, this has really been an insightful conversation that we've had. Thank you so much for your insight, and thank you for your time.
Thank you very much for having me on the show.
Catch up with us on our social media pages at our handle, HealthCheckSA. And until then, I'm Dr. Sello Mudau. Stay healthy, stay vibrant, and always check in on your health.